Hello everyone, I'm Boranbay, an English teacher at Almaty Higher Medical College. Today I'll be talking about scarlet fever, a bacterial illness that mostly affects children but can have serious complications if untreated. Let's explore what it is, how it spreads, its symptoms, treatment, and how to prevent it. Scarlet fever is caused by group A Streptococcus bacteria. These bacteria produce toxins that make people feel sick. They cause a red rash and high fever. Scarlet fever mostly affects children aged 5 to 15 years old. It's very common in schools because children are close to each other. Scarlet fever is closely related to strep throat. If strep throat is not treated, it can turn into scarlet fever. That's why early diagnosis and antibiotics are important. Let's look at the main symptoms of scarlet fever shown in this table. The first symptom is fever. In most cases, the fever is above 38 degrees Celsius and it starts suddenly. This high temperature is one of the first signs that something is wrong. Next is a sore throat. The throat becomes very painful and the tonsils are red and swollen. Sometimes there may be white patches on the tonsils as well. This makes it hard for the person to swallow or speak. One of the most typical signs of scarlet fever is the rash. It feels like sandpaper when you touch it. The rash usually begins on the neck and chest and then spreads to the rest of the body. It's red and rough and it may be itchy. This rash helps doctors recognize scarlet fever quickly. Another unique sign is the strawberry tongue. At the beginning, the tongue looks white with a coating, but after a short time, it turns bright red and bumpy like a strawberry. That's why it's called strawberry tongue. Finally, there is usually no cough or runny nose. This is important because it helps doctors tell the difference between scarlet fever and common viral infections like the cold or flu. If someone has a sore throat, high fever, rash, and no cough, scarlet fever is likely. These symptoms usually appear very quickly, and it's important to see a doctor and start treatment as soon as possible. To diagnose scarlet fever, doctors start with a physical examination. They check for signs like a red rash, sore throat, fever, and the strawberry tongue. Then, to confirm the diagnosis, they do a rapid strep test and take a throat culture. The rapid test gives results in just a few minutes, while the throat culture takes more time but is more accurate. Sometimes doctors also use blood tests, especially if the symptoms are not clear. They may check CRP levels, that means C-reactive protein, and white blood cell count. If these are high, it shows the body is fighting an infection. So, the diagnosis combines what the doctor sees and what the lab tests show. This helps make sure the patient gets the right treatment quickly. The treatment for scarlet fever includes antibiotics, usually penicillin and amoxicillin. These medicines help kill the bacteria and prevent serious complications such as rheumatic fever. It's very important to take the full course of antibiotics even if the patient feels better after a few days. To reduce the fever and pain, doctors recommend medicines like paracetamol and ibuprofen. These help the patient feel more comfortable and rest better. If the rash is itchy, antihistamines and calamine lotion can help calm the skin. Drinking plenty of water and resting are also important for a faster recovery. And the next table compares the effectiveness of treatment for scarlet fever over 7 days with and without antibiotics. As shown, patients who received antibiotic treatment recovered faster than those who did not. The symptoms in the antibiotic group improved significantly within the week, while the group without antibiotics experienced a slower recovery with symptoms lasting longer. This clearly shows that the treatment with antibiotics speeds up healing and reduces the risk of complications. If scarlet fever is not treated, it can lead to serious complications. One of the most dangerous is rheumatic fever, which can damage the heart, especially the heart valves. This can cause long-term health problems. Other possible complications include throat abscess, ear infections, even sinus, and meningitis. That's why it's so important to start treatment early. Antibiotics not only help the patient feel better faster, but also prevent these serious problems from developing. There is no vaccine for scarlet fever, so we must be careful. The best way to prevent the illness is good hygiene. People should wash their hands often, especially after coughing and sneezing. Don't share food, drinks, or utensils with others. If someone gets sick, they should stay at home to stop the infection from spreading. After taking antibiotics for 24 hours, the person is no longer contagious, so they can go back to school or work safely. To conclude, we've seen that scarlet fever is an infectious disease caused by the bacterium group A. streptococcus. It presents with recognizable symptoms, including fever, sore throat, and a characteristic red rash. The infection is effectively treatable with antibiotics, which help reduce symptoms and prevent the spread of the disease. Early diagnosis and timely treatment are crucial to avoid potential complications such as rheumatic fever or kidney inflammation. With proper care, patients typically recover fully without lasting effects. Thank you for your attention. Stay informed and safe.